Fire dispatch, what's the location and nature of your emergency?
Fire dispatch on the air from Medic 1 for the 49-year-old male. Altered mental status, previous unresponsive.
We got a call for altered mental status. This is a patient who had not been acting right. His wife calls us. Altered mental status could be anything. Sepsis is the body's overwhelming and life-threatening response to an infection that can lead to tissue damage, organ failure, and death. Sepsis always begins with an infection, but it's not the infection that is the heart of the problem. Just like in anaphylaxis, some people will get stung by a bee. The life threat isn't the bee sting itself, it's the body's overreaction to the bee sting. Hi. EMS winds up seeing more patients with sepsis than patients who are having strokes or heart attacks. In a lot of EMS systems, the EMS providers are really the primary care providers for the community. In some situations, EMS providers are obtaining blood cultures and even administering pre-hospital antibiotics. Get ready to sit you up, get you moved over onto our stretcher, get you on the way to the hospital, all right? Things can go from very subtle and low to downward spiral into shock. Reassessment is key. It's not always sepsis, and even if it is sepsis, it doesn't always progress to septic shock, but it can progress so quickly, it can be easy to miss when those vital signs start turning downwards. Like, how do we know the difference between somebody who's just sick and somebody who is septic? Temperature, heart rate, respiratory rate, fast respiratory rate, or a low end-tidal carbon dioxide, any combination thereof. But it really comes down to the fundamentals. When we arrive in the ER, we want to be able to say, this is a sepsis alert. Or if no system is in place for an official sepsis alert, we want to say, I suspect sepsis, so that the staff in the ER can pick up the patient at this point. If we don't have that collaboration, the EMS patient is going to be dropped off and the ED is going to start care all over again, effectively moving the patient backwards on the continuum of care. Some hospitals have a sepsis coordinator or specialty sepsis teams. They're not universally available. You may come to a very well-qualified hospital, but they don't have a sepsis specialist. There is no sepsis specialty like there are cardiologists. And that's why EMS is even more important as that first safety net to ask the right questions. He cut his hand a few days back and it really wasn't clearing up. One of the most important things to be able to help move this patient forward isn't any medicine that you're going to give in the back of the ambulance. It's making sure that you identify sepsis with a good, solid assessment. So when your gut tells you something's wrong, continue that assessment and then providing that in a really good handoff to emergency department personnel.
Let's get him over, keep the fluid bolus going, get his lab started.
Sepsis can be triggered by an infection from any kind of pathogen. It could be bacteria or viral. It could even be triggered by a parasite or a fungal infection. Sepsis is easy to miss because sepsis is so subtle and flies under the radar in the body. We can miss it until it suddenly becomes so obvious that it's sepsis that we've lost our opportunity to treat. We're the ones who are going to be putting together the big picture. That's really up to us to stay sharp for these patients. Number one, because it's the right thing to do. Number two, because the sooner that we can catch sepsis and the sooner we can begin treatment, the easier it is for this patient, for their family, and for all of the healthcare providers in the community. We're stopping it before it becomes a resource-intensive, cost-intensive course of care. I got one last thing to leave you with. It's to be heard. Spread the word. Unrecognized sepsis kills. Thank you very much for your attention.